Welcome back to our Market Insight broadcast. This is John Gatewood, founder and CEO of Gatewood Wealth Solutions, and with me is our Chief Investment Officer, Aaron Tuttle. Welcome, Aaron.
We're back together.
We are back together. You were up north in Minnesota. I was down south in Florida, and now we're in the middle.
We meet in the middle.
And a lot's changed since we got back because we've been flip-flopping on this mask mandate in the St. Louis County and City because it was, well, at least in the county, they mandated it on Monday. All of a sudden, they overturned it yesterday. And then the CDC has some new guidelines, right?
Yes,
and so we're getting questions from our clients. Well, what's this going to mean to the market? Because there's a lot of noise out there. And so what we really want to uncover, what are the signals and the things that are going to actually impact how the market might move? So forget about all this political talk that you're hearing in the news. We're going to talk more about the data behind that.
Right.
But first, why don't we talk about where the performance has been year to date with all the different asset classes?
Well, when we're looking at the 1 week, and that's in the left quadrant, the upper quadrant, we can see that growth has done better than value. And we've talked about over the last couple of weeks, whether it's a 3x3 or even the Market Insight, one of the concerns that we had was the way that the market was reacting. So one signal that we were getting early on before any of the political shenanigans started to take place was the market was pricing in or signaling a possible lockdown because everything was moving up into that large cap growth category. Now, we found it an odd movement, but this time we had seen it before because we saw it going into the previous lockdown with things moving to technology, and we took the big weight in technology. And we were already starting to rotate towards growth. So the market was picking it up to a point that we were noticing the signal. And what's different this time is that it's a signal that everyone had seen before.
Yeah, so it's interesting in that we didn't have the large sell-off all of a sudden like we did back in March, but is that possible? I mean, anything's possible, but what would we see?
The way that a market prices something in is the probability. So let's say if we're locked down, we get a 20% sell-off, but it's only a 5% chance, then you're only going to get a 1% adjustment.
I see. And
as that probability increases, you'll start to realize more and more of that uncertainty into the price. So right now, with yesterday's sell-off, and we didn't see a rotation trade, it's kind of confusing, but it looks like the probability has actually been reduced for a lockdown. And maybe that was the market's already anticipating and realizing here in St. Louis, it was expected a 4-3 vote. It ended up being a 5-2 vote to rescind the mandate. So the market may be getting information and processing that. I'm not saying that somebody is or isn't aware. It's just the market is figuring that out through the magic of the market whenever it starts gathering all the collective information.
So let's talk about the increase in the COVID cases because we're now seeing that rise across the states. And how does that look?
Well, if we look here, we have Louisiana being the highest in the United States. So the U.S. has a 49% vaccination rate. And we can see the first couple of states, Louisiana, Arkansas, Florida, as well as Missouri, even though Florida and Missouri are getting a little bit closer to vaccination rates. So there's a narrative out there that, well, the problem is that we have these unvaccinated individuals. And we wanted to, like good scientists, what you do is you say, okay, that's the narrative. Can we find different information and try to understand what's actually happening to understand? It's very hard to predict what politicians will do, but still try to get an understanding. So when we look in the data, well, we can see the hot spots. And even though the mandate was here in St. Louis City, St. Louis County, not the state of Missouri, it's really showing up in the Ozarks. So you got to go down to Springfield, and then it's crossing down into Arkansas as well as Louisiana and moving over to Florida. So then whenever we look here on the Missouri map, we can see that increase in cases. We can see a slight uptick in deaths, but a decent increase in hospitalizations. And then if we look at that top right, that's the hot spots, but then we look at the risk levels on vaccination and other factors. We can see that the city itself is actually not one of the places that are risky. So whenever I look through, there's I think 117 counties. I have a video here. Let's see if we can get that to play. We can see that St. Louis is actually, I think it was number 77 out of 117, very close to St. Charles, and then Kansas City is also near there. And a lot of the counties that are around those areas are also towards the bottom. Now, That's a lot of data here, and I'm looking at cases per 100,000, and then I also see the vaccination rate. Well, there's a simple way to understand, is there a relationship between the amount of people vaccinated versus the amount of cases? And there's no relationship. It was negative, but it was negative 0.22 on a correlation, meaning that it's basically
It's
there
very
isn't a
even.
relation.
Yeah.
So if we look at Scotland County, there's a 20% vaccination rate, but they have a very low amount of cases per death. What I think is happening, or another narrative that wouldn't be the vaccinations, is the urban areas, which have more people, would have had more exposure to the vaccine. It's a lot easier to transfer the disease or the virus if people are in close proximity. What we're probably seeing is the disease finally making it out in the rural areas where it doesn't transfer as easy.
Yeah.
So whenever we're looking at the data, that seems to be the explanation that isn't disproven easily.
I think that the one thing that you said was talking about deaths too, and so we've been looking at the Johns Hopkins data every day, and then the CDC data. And one thing that's very encouraging is that even though we've had this spike going on, which started on July 2nd, that was the turning point, the number of deaths is still pretty much flatlined, and we're still below where it was in mid-March of 2020 on the deaths. So the good news is that we've clearly found a better way to treat people with COVID, so we're not as at risk of dying. And I think that's the thing that was more fearful earlier, wouldn't you say?
Yes. One, there's the dead timber analogy that is often used for a pandemic, which is that first wave. There are still a lot of people that are unhealthy that would live a year or maybe 2 years left. And that's that straw that breaks the camel's back. So once you clear that on that first wave, and I hate saying that about people,
right?
But then you have a healthier population left over. Also, a lot of the places that were hit hardest at the beginning were long-term care facilities. That's kind of gone through those long-term care facilities. So we're seeing the average age, from what I've read, I don't have the data, so this is from what I've read, the average age of the people that are testing positive has been decreasing. Plus, we have better therapeutics. We have a better understanding of how to deal with it. Another thing that we see is Florida in there. Now, if we look at last year, we see that there is an increase in July, and there's an increase again in July now. So we had talked about how Florida, Texas, those areas, how they were late in the first wave in the states, and that we would expect to see an increase. So that lines up with the seasonality explanation. Now, if we look at New York, we can see July they were flatline. There's still an incremental increase right now in New York. Now, it's not where New York is ranked high among the states. So that blue state, red state narrative doesn't seem to hold up. It's more that seasonality. That being said, there's still an uptick in New York. So there seems to be some increase in cases. It's not just the seasonality effect, but we can see that factor is certainly playing out here in Florida. And then what about vaccination? So the idea is that the higher percentage of vaccinated individuals, the less likely you're going to have an outbreak. Well, we have the numbers of vaccinations per, I want to say country, but Gibraltar is really a region of the United Kingdom, right there at the bottom of Spain, on how you get out of the Mediterranean. And that's still a UK territory. They have 116% vaccination rate. Well, I know they don't have 116% vaccination.
Maybe they're vaccinating all the tourists that come through the country.
Maybe. I think what's happening, and this is one of the problems that we deal with data, is that it's not always clean data. So it's probably they have had more vaccinations than they have the people, and there's probably some double counting there. We have this during the cases, is you may get tested a couple of times if you're in the hospital, and there's no way for all the hospitals to have a good process to distinguish. This was John's third test.
Right.
So then those continue to get lumped into the case count. The data is not useless, but just know that it's not very clean. But it's pretty much consensus that Gibraltar is the most vaccinated area, and their cases are increasing. Canada is the second. They don't have a lot of cases, back to that seasonality. So there are multiple factors that are playing in. The United Kingdom is highly vaccinated, and they also have a case increase. Now, one of the things that's coming out of this is they just had their Freedom Day, meaning that they've ended the lockdowns and mask mandates here recently. Now, Niall Ferguson, who was the author of the Imperial College, who said that we would have 2 to 2.5 million deaths here in the United States, and was really the academic reason used to go into the lockdown early on. Well, the 2.5 million never materialized. He had said that once they removed the mask mandates and they had this Freedom Day, that they would have 200,000 additional cases a day because of opening up. Ever since that day, it's been moving down. I don't know if it's coincidence or if there's some reason that maybe being out and being more around fresh air. I'm not going to pretend. It just shows you how these models don't always reflect reality. Best guess. Not saying that anyone's up to nefarious things, but it just shows how these explanations are not there. United States is also near the top on vaccinations, and if we compare that to Sweden, a little bit ahead if you include all vaccinations, single dose and double dose, but Sweden has actually less fully vaccinated individuals. We can't talk about coronavirus here without going back to Sweden, because that's been our control group.
Correct.
Sweden. They didn't mandate lockdowns and they didn't mandate masks. And that's not to say that people are not wearing masks and that people are not quarantining. They certainly are.
Right. They left it up to a personal choice.
Right. So that people manage their own risks, and for the most part, they had stayed open. Now, their economy did better relative to others. People that seem to have an agenda say, well, their economy went down. Of course it did. We were in a global pandemic, and the global economy went down, so then there would be less trade. So that's not surprising. Sweden has a slight uptick in the new cases, but they haven't had, I read earlier, it's been 6 days in a row with they have 0 COVID deaths. Now, they're definitely lower than most people on the COVID deaths, even though that most places the death versus cases have certainly improved.
Yes.
But going to Sweden, it looks like they have achieved that herd immunity. They are doing better. They have already received all of the people that are in critical condition have been protected. So it seems that they are out of this situation where many of the other countries are still struggling. Because remember, it was to flatten the curve. You would still have the same amount of population. So everyone's curve that tried to do these things it's longer. Sweden had an impact and it came down, and it wasn't a horrible impact relative to what was projected. Now, they depending on the time period, Norway's a good comparison. They were a little ahead of Norway initially, but really similar results, just in a much closer time period.
Interesting.
Another thing that's interesting that I don't think gets a lot of attention is the per capita deaths. So if we look at the places that have been hit the hardest, they often, not always, are the more aged areas. I think certainly the areas that have poorer health, so the U.S. is one of them. We have an obesity problem relative to the world. Europe also has struggled. Now, Japan is much older than any of them. No issues. Africa also, unless you're down in the south near South Africa, really not many deaths. Well, that's because it's a very developed, very young population. I think it's 3% of the population is age 65 and over. So
wow.
That just shows how there are different factors that can be playing in here. And then finally, if we look at the deaths in the United States, slight increase relative to where we were, but it is very slight. It's nowhere near where we were back in March or April. So I think the political pushback is to not have or not reinstate the lockdowns. So that seems to be what is happening. Obviously, this can change, and all of a sudden, if those cases or those deaths begin to spike, this whole conversation is going to be redressed again. The market will begin to price that in.
Well, let's say if I had to kind of summarize it, is that it's because we have better therapeutics and we're able to better control the death rate per case. That's probably a signal to the market that even if we have an increasing cases, that it's not going to have the same impact on the market as it did in the past, because we probably won't have the same draconian type of lockdowns.
Right.
Now, not to say that it can't happen, but again, as you said, it's what are the odds of it happening, and that's what we think is being priced into the market. Would that be a fair way to summarize it?
Yes, and then I would say, hopefully, we can get to a different approach on how we're doing this, whether it's media or politicians. There are a lot of headlines and narratives that are not exactly true being put out there. Our feeling is that we should look at this in a way where we almost have a flow chart. Are there more cases? Right now, yes. Are we testing more? Yes, we are testing more. That could cause more cases, but it's also very reasonable that if all of a sudden you have more people having symptoms, you're going to have more tests, so you would have more cases. So you can't just stop there and say, we're testing more. That's the explanation. You got to keep digging. So is anyone in the hospital? Yes, there is an increase in people in the hospital. Okay, but is anyone dying? And we've seen a slight increase, but it's not near what we expect. So how do we figure out, how do we gauge are people dying? Well, we need to go back and say, are there any excess deaths? Are we experiencing more deaths during this time frame than we did in probably not 2020, because you got to throw that year out, 2019, 2018, 2017.
Do we have that data?
So the data is there. We don't have easy access to that data. Hospitals, the CDC, they do have those, and they have them by category. So they know how many people typically die of heart disease, how many people die of cancer, how many people die of flu. And right now we're not seeing excess deaths whenever we are to look back. Now we have the very generic data, so we're just making that statement. And remember the statement on the dead timber effect. You could actually have a slightly decreased excess deaths because many of those people were brought forward. So you just need to be near before you start to question. And the final question is, okay, what are the comorbidities that individuals have that are dying, and is there a specific age profile? Because it may be a better and more effective method to allow others to have access and ability really to be exposed to the virus while you quarantine specific age groups to protect them, because herd immunity gets hit whenever a percentage of population, doesn't matter elderly or young. So one thing that you could do, and we probably will do if we have pandemics going forward that have similar profiles, is you let the virus run with the people that are not at risk, the children, the people that are in their 50s and younger, because if once we hit a certain percentage pool, then there's just not enough susceptible people, and then the virus would slow. So this is the flow chart that I think over time we will begin to adapt on how to deal with these pandemics going forward, because it really starts to cut through the noise to say, okay, what is the actual threat here?
Right. So where are we with regards to the market, our themes, our
So our themes
views?
are still there. We have an inflation theme, GE and 3M. Were added to the list of companies that's saying this is not transitory inflation. It's here to stay. So that they're in their earnings report and their update on their company, that's something they said. But we are in earnings season. This is a little bit dated. We're at 88% beat estimates, meaning that 88% of the companies that have reported so far are above expected earnings. So we continue. We're actually surprised by this. We expected to see that number start to drop down to more normal numbers, not to continue to be high, because we're now, I think, 4 quarters in on where you would expect to see some consensus and some misses here. We're still not seeing that. That means that companies are growing their earnings above what expectations are, and they're doing it significantly. So we have revenue growth of over 20%. We're at, I think, 20.9 on the actual slide, and then earnings percent share growth is 74.4%. Now we're coming out of a recession, so you got to take that with
Right.
an understanding of that base effect. But we're in that earnings season. Earnings are looking strong. The S&P 500 continues to climb and make new highs. We did have a sell-off yesterday, but it's nothing out of the ordinary. We did bounce off the 50-day But we continue to move up. We have that price objective of 45.60 before we think the market has to take a breather and reassess its valuation. Obviously, at any point, the market can sell off. It doesn't care what our opinion is or what technicals say. But just from what we gather, that seems to be the direction that the market is moving. If we did have a sell-off, one, there's a lot of cash in investable accounts, so there's a lot of dry powder that could go in, or probably looking for an entry point. So we don't think it'll be that high, and we would see it as a buying opportunity if that were to happen. Once again, when we're looking at relative strength, technology, U.S. large cap growth, that's the place to be. The S&P 500 is near the top, meaning that diversified allocations are going to struggle when compared to the S&P 500. The only thing that's really doing better is that large cap growth sector. Real estate has been trending down, and we have fundamentally, we think it's overvalued, but the technicals has kept us there, so we've had a neutral weighting. If that was to become technically negative, we're going to re-examine that position, make sure that our fundamental assumptions are still bearish, and that if we have technicals that are saying bearish, we may make some changes there.
Well, that was very interesting. You know, one of the things I was thinking about in the presentation is about how we're trying to follow the data. I just finished reading this book called Think Again by Adam Grant, who's a PhD psychologist. He talks about how when people have ideas, or let's say a narrative, there's 4 types of people that come out. The preacher, prosecutor, and politician. He said, so if you have an idea or a narrative that you want to portray, you preach it to people, right? And then if you don't agree, you become the prosecutor, or if someone doesn't agree, you become the prosecutor. You tell them all the reason why they're wrong and you're right? So it's confirmation bias. Or you're the politician. You just try to find a way to win them over. But the point of the book was, why don't we approach information and ideas or thoughts like scientists? You know, when data comes in, your view of the way things are changes because of the data, not because of just some principle that you want to preach, prosecute, or politic. So that's what we're trying to do here in our investment committee. We're trying to separate ourselves from all these emotional attachments or intellectual attachments and really look at the data to see what is this going to do to the market.
Yes, we do try to do that, but it is hard. I would say scientists struggle with actually thinking like scientists as well.
Yes.
And oftentimes we build models and what we conceive of how the world works, and they may actually not reflect how the world works. So you can even get tripped up as in following the data. I saw it was kind of like a Far Side type cartoon where it was saying the UK had so many medals, and if they continue on, half the population of the United Kingdom will all be gold medalists in the Olympics by August.
Yeah.
So you can get tripped up even in models and just trying to look at data. So
yeah.
It's always important to question and really challenge any of the narratives you have. You shouldn't try to prove a narrative. You should try to disprove your narrative. Find out where it doesn't fit, where it doesn't work.
Well, thanks again for your presentation today. That's great information. We thank you all for joining in today. And as always, what we're trying to do is to get to the truth through our data, economic theory, and so on. So if you have any questions about your portfolio or you'd like to contact your lead advisor, please be sure to reach out to the number on the screen. And as always, we're trying to attract new subscribers. So how would they subscribe?
Well, they could click up on the subscribe button down below for the YouTube video.
Okay.
But if they wanted to get a hold of anyone, a lead advisor, they could go to our website and request to have a discussion with them. That button, I think it's in the top right hand.
Great. Well, thanks again. We hope you appreciate the information that we provided you today, and we look forward to having you back again next week.